everyone, and welcome to Gruff Talk, where each week we take a deep dive into all the ways we can feel better, look better, live better, and age better. I'm your host, Barbara Hannah Grufferman. Here's a fact. Your new body as a post-menopausal woman will be different and will have different needs than before you started your menopause journey. So to talk through all these changes is Dr. Margaret Nachtigall, who is a board-certified reproductive endocrinologist at NYU Langone Health, and is also the medical director of Menopause Cheat Sheet, a free newsletter we publish together to help women navigate life before, during, and after menopause. If you want to check it out, go to www.menopausecheatsheet.com. In this episode, Dr. Margaret Nachtigall and I will talk through 5 key changes that happen, why they're happening, and what you can do to mitigate some of the risks that are involved with these changes, because the medical community understands and really wants you to know that there is a window of opportunity of about 10 years after you hit that one day in time when you haven't had a period in 12 months and you are officially a post-menopausal woman for the rest of your life. You've got this window of opportunity to really take action. You got that? 10 years. It sounds like a lot of time, but trust me, you want to get started doing everything you can to set yourself up for successful aging as soon as possible. But for sure, after you become a post-menopausal woman. So view this as a celebration of your new life and give yourself the gift of knowledge and action. Lots to talk about, so let's get started. I'm excited to bring back Dr. Margaret Nachtigall to the show. She's a board-certified reproductive endocrinologist at NYU Langone Health. She's also the medical director of Menopause Cheat Sheet, a free newsletter that we publish together to help women navigate life before, during, and after menopause. So hello, Dr. Margaret, and welcome back to Gruff Talk. So today we are going to talk about the 5, like you and I chose them, the 5 top things that we feel are like change the most, or certainly the ones that we really want everyone to pay attention to. Let's start with the brain. We'll go from like top to bottom. We'll work our way down. First, Dr. Margaret, let's talk about the brain and the changes that are happening there as women experience drops in estrogen.
Great. Well, I love to be here and I love speaking with you. So I'm really excited. And of course, I love talking about menopause. So we'll start with the brain, which we could bring all the things that happen with lack of estrogen in the brain. We could probably divide it into at least 30 different areas, but I'm going to talk about the major brain changes. So without estrogen has receptors in the brain. So it's really not surprising that when there's no estrogen, there are some significant changes. Every person is different, so not every woman going through menopause is going to experience the same symptoms. But here are the common effects of no estrogen in the brain. First of all, there's what we call brain fog or lack of memory. And this happens to a majority of people. In some cases, it's very short-lived, happens around the time of menopause, and then it dissipates and gets much better. In others, this is really prolonged, and it can have a lot of varying presentations. For instance, you cannot remember where you put your keys. And that's a really big one. One for me is if I have glasses on, I'm looking all over the house for my glasses that are on top of my head. Little things like you used to go to the grocery store and not require a list. Now you do. Or you can't remember someone's name. Nouns are particularly difficult. In other words, you can't think of the word banana, and instead you circumvent and you say that yellow fruit that you peel. Something like that, because you're trying to figure out how to go about, how to cope with this new lack of memory. And this can be mildly troublesome for some, but majorly troublesome for others. The other things memory is a big component effects of the brain. Next, we come under sleep. Sleep is really a brain function and difficulty sleeping. The biggest part about the change in sleep after menopause or with lack of estrogen is that time from when your head hits the pillow till you fall asleep. It's called the sleep latency. And that period elongates without estrogen. And so that can be a really big problem. You can't fall asleep. The other thing can happen is you can fall asleep, stay asleep for a short limited amount of time, wake up, and then not be able to fall back asleep again.
And Dr. Margaret, that's really been my ongoing problem. And this started to happen to me as I went through menopause. And then, of course, as I got out of and became a postmenopausal woman for the rest of my life. And that is my issue. I fall asleep immediately. And in fact, my Apple Watch shows that that's when I get my deep sleep. I go right into deep sleep. But then I normally wake up like 2 or 3 o'clock in the morning. And I usually end up going back to sleep, but it never fails. I wake up literally every night almost at the same time. This is common.
Which is really, really troublesome. It's very common. You have it. Many people have it. And the problem is that, as you know better than anyone, because I know you've done a lot of research on this, but lack of sleep can affect us in so many different ways. It can affect our happiness. It can affect our wellness. It can affect how we're thinking. It can affect our memory. It can affect our ability to function the next day. It leads to so many factors.
It can even affect weight.
And it affects weight. Yes, tremendously, that's going to be one of the things we talk about, but sleep affects weight. Absolutely. And so this is a really, really important area. And this is something that changes. And it doesn't happen to everyone, but it does happen. So sleep is huge. And then one of the other things that affects sleep that happens in the brain is there's a function in the brain that controls our heat and cold tolerance. And so hot flushes are another thing. And in some individuals, the hot flushes that occur with menopause are brief. In most people, they're done by about 5 years. But in some people, they continue for 20 years and continue to be troublesome. And they can happen not only at night, but they can happen during the day. They can happen frequently or infrequently, depending on the person, but they can also affect sleep. And of course, once we disrupt our sleep, we have all the other factors that come into play with this difficulty. The other is mood. People that are without estrogen can have either moodiness, which is up and down dysfunction, or
mood swings.
Depression. So mood swings or depression. Depression is more common after menopause. And so this is something that's really, really changes. And this is a brain function. So those are some of the major things that we find: memory, sleep dysfunction, hot flushes, mood changes, and depression that can occur after menopause.
I'm so glad that you put sleep into this category of brain health, because it's so important. And everyone, I want you to know that next week, literally next week, the show after this one, I will have on as my guest a leading expert in sleep and breathing. And it was a fascinating conversation. It was already recorded, where he talked about women in midlife who do have issues with sleeping and sleep apnea specifically, and hot flashes and night sweats and the like that are keeping them from getting a good quality night's sleep. And how, from his point of view, his studies have shown that by incorporating breathing practice into your lives, like in your daily lives, that can actually help some women sleep better at night. So I just wanted to throw it out there. It's something that you may want to, listen to next week and see if it helps you as well.
Just before we even move down, I think that brings up what we can do to prevent these things that naturally occur from being so troublesome. And one of them is what you described is, breathing exercises. And there are a lot of different ones. And I can't wait to learn from you about those specific ones that will be beneficial for sleep. But I think the key thing is for individuals to find what's best for them and to find what works for them to keep them less stressed. That's helpful for sleeping, to keep you happier during the day, to improve your relationships with people, to be able to keep these things in check. And in terms of memory and brain, trying to do tasks that improve memory, whether it's puzzles or taking on a new activity. Exercise is helpful. In fact, I noticed that every single thing that we're going to talk about, all the 5 key areas that we're going to address, each one of them, exercise seems to be beneficial for a treatment. So I'll put that in there. And, finding an exercise that you enjoy, something that makes because if we do something that we hate, that's not going to be so helpful for us. So doing an exercise
You
that we
won't stick
enjoy,
with it. Right.
Right. That's going to be helpful. And also if we exercise earlier in the day, that's probably going to help with sleep as well, but it certainly helps with mood, may even reduce some of the hot flushes. And of course, talking about estrogen and bringing estrogen back may also be an appropriate treatment for some individuals.
With hormone therapy, you're talking about
therapy,
if that works
right,
for somebody.
If that is what's right for that individual, but that can mitigate and actually alleviate the symptoms that we just discussed. All right. Now,
and before we move on though, about exercise, and thank you for, bringing us back to talk about some of the things that we should all be doing. And you and I have talked about this too in recent episodes, that a particular kind of exercise really does seem to help the brain directly, and that's strength training. Now, sure, we all want to get the cardio in. It's good for our hearts and our bones and, our weight management and everything else that you said before. It's like exercise really is kind of like all roads lead to fitness. But strength training really does seem to be very connected to brain health. And so I just wanted to throw that out there. But yeah, moving down now in the body, we're going to go to the heart.
Going to the heart.
So what is happening with our heart? Very quickly, and I did talk about this in a previous episode of Gruff Talk and in Menopause Cheat Sheet, but with me, as I was going through menopause, I started to have heart palpitations. And this is very, very common. And of course, I thought I was having a heart attack, and I was really quite alarmed. And then when I discovered what was really going on, of course, then I felt a lot better about it, but I still did have to suffer through some periods of heart palpitations, which was, like I said, alarming. So what's going on there?
Well, first, just to sort of rebound on your heart palpitations, that is one of the things that can occur. And you did the right thing, which is first, you evaluate. You see your primary care doctor, your internist, perhaps a cardiologist, and you do all the tests to figure out why you're having heart palpitations. And in some instances, there is no other explanation other than the lack of estrogen.
Right. And as you know, and I've said publicly, I never was on HT. So therefore, I had no estrogen.
And I have other patients who have heart palpitations and come to me with this and go on hormone therapy, and they reverse, they disappear. So it is one of the treatments for that. But I'm not saying that people should necessarily start estrogen if they're having heart palpitations without getting an evaluation.
Right.
But of course, that is one of the possibilities. The other thing that happens for your heart is that estrogen happens to keep HDL levels, when we're talking about cholesterol, the good kind of cholesterol, but we're not really talking about good and bad anymore. But HDL, which is a favorable type of cholesterol, does a lot of good things for our body, is higher with estrogen. And so when we have this lack of estrogen, that means that we're getting lower levels of HDL. And so that makes a less favorable cholesterol profile. When lipids are becoming less favorable, that means there can be an increase in plaque formation in the blood vessels, which is a sort of a roundabout way of saying that there are many studies that have shown benefits to people who are on hormone therapy or on estrogen therapy in decreasing heart disease. And that is really probably specific to people who are trying to reverse or eliminate the plaque to being formed. Those are some of the heart effects that we talked about: palpitations, change in lipid levels. The other is that without estrogen, there's also a relative speaking insulin resistance. And we're going to talk about weight at the bottom of the list, but there's an increase in weight that occurs in the middle, an increase in adipose tissue and the bad kind in the belly. And that can be worse for the heart. So again, what can we do to alleviate or not have this? Changing the diet a little bit, maybe eating a little bit less depending on the individual, but really focusing on more protein, fewer carbohydrates, increasing exercise, and hoping to prevent any type of heart changes. And the other is seeking, you going to your doctor at this time and checking your lipid levels and seeing if you need anything to help your lipids, whether it's an over-the-counter product, whether it's an adjustment of your diet, or whether it's some cholesterol lowering agent. So I think that's really a good time. I've said this, a number of times, but menopause is a great time to go get a checkup.
Right. It's a great time to reassess everything that you've been doing, whether it's, what you've been eating, how you've been exercising, any medications that you have been taking. All of that probably will need to be tweaked a bit because Dr. Margaret, right, our bodies change so much as a result of menopause that, an assessment really needs to be done. And, I've talked about this too. I like to reassess myself. How do I feel? What's my weight like? How's my energy level? What are my health check numbers? What's my waistline when I measure it? All of those different things that can be checked, should be checked regularly. And that to me is my reassessment. Certainly certainly some of those have to be checked every year with your PCP, of course. But just in terms of how you should reassess yourself so that you know what path to put yourself on going forward, it's really important to have that kind of reassessment on a regular basis. So now we're not really moving downward in the body. We're kind of going in and all around the body, talking about bones. Bones, very near and dear to my personal heart, because Margaret and everyone knows I'm very connected to the Bone Health and Osteoporosis Foundation, have been for over 9 years. It's a topic that's of great importance to me that we get the message out, because in my mind, if you don't have strong bones and good muscle tone, you're not going to be able to age as well as you would like. And your risk for fracturing if you fall is so much greater if you don't take care of your bones. The good news here, always good news, we like to share good news, right, Dr. Margaret, is that it's never too late to start. And I think I'm a really good example of that. I didn't start thinking about my bones till after I broke my arm after menopause. And then I really took action. And that was at the age of 50. So it's never too late. So let's talk a little bit about bones. What's happening? Why are they getting weaker? Why should we pay so much attention to them? And what can we do about it?
Bones have estrogen receptors. So the reason that so many parts of our body are affected when we no longer have estrogen or when we go through menopause is because estrogen receptors are found on just about every tissue in the body. They're in the teeth, they're in, as we said, the brain, skin, which we're not going to talk as much about today, but in the skin, and they happen to be in the bones. And what does estrogen do in the bones? Well, normally the bones are in constant shape of remaking. And so what happens is there are osteoblasts that lay down new bone, and there are osteoclasts that eat up old bone. And this is constantly happening throughout life. And as in before menopause, there's a nice even balance where we're laying down new bone, eating up new bones, staying pretty stable. However, when there's no estrogen around, now the cells that eat up bone are working harder and more than those that are laying down new bone. And so what happens is we just have bone loss, really, a net loss. Mm-hmm. And so the ages between the average age of menopause is around 51. It ranges 45 to 55, and there are certainly people on both extremes, which is before age 45 and after 55. However, in general, around age 51. So the average age between age 50 and age 60 is a time of tremendous bone loss. This is a time where women can lose a lot of their bone density. Now, if you start out with fantastic bones, then you lose a significant portion of it. You're still going to have okay bones. But if you start out with a low bone density, so anyone that has a low bone density then goes into menopause and over those 10 years loses bone, that could be very troublesome and could end up having real bone loss, or what we call osteoporosis, with an increased likelihood of fracture. And so these are the people where it's most important to maintain or not lose that bone. And, that's what's happening. That the issue is without that estrogen, the bones are decreasing in their quality and their ability to sustain. So what can we do? Just as you said, we need more weight on the bones. So increasing muscle mass, increasing exercise, actually weight-bearing exercise has a direct effect of improving the bone densities, like you said. I know that it's controversial about vitamin D and whether or not it's beneficial to prevent bone loss. There was one large study that showed that in patients who have normal vitamin D levels, that extra vitamin D may not be beneficial, but there hasn't been that same study for people with low vitamin D. So my feeling is this is a great time to take vitamin D, or make sure you're getting enough vitamin D in your diet or from the sun, and get your vitamin D and exercise, weight-bearing exercise, and try to avoid...
And resistance training too. Weight-bearing, some good examples, right, are running, walking, climbing, dancing, things like that. And then resistance training, like what I've really beefed up in the last 15 years and doing even more now. Remember the reassessment we just talked about. I mean, I am getting older, and I've really increased the number of, the amount of time, the number of days and hours that I put toward resistance training, meaning lifting weights and squats and, using your own body weight. So you don't even have to go to a gym. You can just do it in your own home. Push-ups and the plank, one of my favorite all body exercises. These are super, super important.
And not being sedentary. So even if you're not exercising, maybe you're only able to walk, a short amount a day. But if you're sitting in one place, getting up, sitting down, moving around the office, really trying not to be sedentary. People that are at bed rest are at an increased risk of bone loss, so they have to be attended to specially. People that are on medications, there are some medications that may be particularly prone to bone loss, such as steroids or heparin, which is a blood thinner. Those medications can really play havoc. People who had periods of time where they didn't have estrogen in their earlier life, so people had long periods of time where they didn't have a period. Those patients.
Some gastro issues too, like IBS also.
Chronic.
Yeah. I encourage everyone to go to the Bone Health and Osteoporosis Foundation website, because it is constantly being updated with the most up-to-date research to help you really stay on top of your own personal bone health, in terms of even medications that are out there and exercises you can do, foods that you can eat with recipes. So I really recommend that you just check it out on a regular basis to get some ideas on how to keep your bones strong.
So I think that's a great idea. And then in terms of the good news, as you said, is that we do have agents that can reverse this process.
Yes.
Estrogen is one of them. There are other hormone supplements that can be beneficial. In fact, some of those that also prevent breast cancer can be helpful for the bone. And raloxifene, for instance, tamoxifen, also help bone. And then there are bone-specific agents. There are many of them now that actually act to promote bone health and improve bone formation. And there's so many in different classes that if you are someone that has bone loss, absolutely get attention, because this is something that's treatable.
Right. We could go on and on and on. And in fact, we have gone on and on. We have a whole episode devoted to bone health, which you can just, after this one, scroll back and find it, where we go into even more detail. But thank you for that. So next up is, we are moving down a little bit in the body to the vagina. This is a huge focal point for women who are going through menopause and have become postmenopausal, because a lot of things are happening there. Some of them quite serious, especially if not treated. And Dr. Margaret, could you take over here? What's going on?
Just as I mentioned that there are estrogen receptors all over the body, there are definitely estrogen receptors in the vagina. And so lack of estrogen really plays a big role in vaginal health. The main thing that happens is the pH of the vagina when estrogen is present is around 5. And when there's no estrogen, it rises, it goes up, it could go high as 7 or 8, or even higher. And what this means is there's a very big change in the bacteria that can live in different pHs with different acidities versus basic environments. And this change in pH means that there's a change in, we call the flora, the natural bacteria that live in the vagina. Just the pH change alone increases the likelihood of developing different kinds of infections, vaginal infections. Also, with this change, with this decrease in estrogen and decrease in or increase in pH, there's actually less collagen formed. And without this, the walls become thinner. They're less able to stretch. And this, with that thin, and there's less moisture. So all of that together can create an environment that, one, is very uncomfortable. People will describe this as feeling like sandpaper.
Mm-hmm.
And there's itchiness. So people are uncomfortable. There's pain, there's burning, and also pain on intercourse. So there's a lot of factors and a lot of symptoms that occur from this lack of moisture, lack of stretchiness, increase in pH, and an increase in infection. And if that's not bad enough, that higher pH and that change in flora can also, the urethra, which is present down there, which is where you urinate from, can also be affected. And so it increases the likelihood of a urinary tract infection.
Mm-hmm.
So these are areas which can be helpful. And really almost everyone eventually without estrogen will develop some vaginal dryness. And what can we do about this?
See, that's interesting that you're pointing that out with all of these other areas of the body that we've covered so far. Not everybody is going to be affected, but in this case with the vagina, really, as you said, eventually the vast majority of women, right?
Some people will be affected after a year of no estrogen. Right. Some people 3 years. Some people it takes 10. Some people it takes 20. Mm-hmm. Sometimes it's present, but there are no symptoms. So sometimes I'll have an individual where I can tell on my physical exam, the pH is 8, which is high. The walls of the vagina are very pale. There's no stretchiness at all. And so I know that there's dryness. But when I say to them, are you bothered? Do you have any itching? Do you have any burning? Do you have any pain on intercourse? No, it doesn't bother me. Okay, then you don't have to treat it necessarily unless you're getting frequent infections. Mm-hmm. But there are a lot of options for treating. There are moisturizers, there are lubricants, there are over-the-counter products.
We also did an episode all about this too, but moisturizers are really used to moisturize the lining of the vagina. Yes. But whereas lubricants are really more for sexual purposes. Am I right? Pretty much?
Yes.
Okay.
Yes,
just
absolutely.
To be clear on
terms. And those can be over the counter. And some people use natural oil products such as coconut oil. Mm-hmm. Be very helpful. Hyaluronic acid, which is over the counter. There are suppositories, there's cream. That can be really helpful because that not only improves the moisture, but it actually can bring in some more collagen and can help restore some of the normal vaginal epithelium and prevent infection and lower the pH. Mm-hmm. So that can be really helpful, the hyaluronic acid. And then, of course, if those aren't working or for people who can take estrogen vaginally, there are tiny little estrogen tablets, creams, gels, etc. Yep. That can be used to really replenish.
Prescription you're talking about now from your doctor. Yeah. That is what I have been on for 15 years. Mm-hmm. So it's a topical treatment, not systemic like hormone therapy,
and that's so important,
which was my choice at that time. And I stuck with it.
It doesn't get absorbed. Mm-hmm. Maybe a trivial pain. And most people can take that. Even people who have had breast cancer, for instance, many of those can still take a vaginal estrogen because so little, if any, gets absorbed. However, there are some individuals that really cannot take it. Someone that might have had an estrogen receptor positive tumor that cannot take any estrogen, even vaginal estrogen.
Right.
And for those individuals, they can't take it. But for most, and that's why it's still prescription, but for most people, they can. Mm-hmm. This is a really, really important area. And just as you said, Barbara, we've done episodes. We could talk for a very long time. And actually, I have several patients a day that come in with vaginal dryness who have been treated, not treated, et cetera. And it really is a big issue.
And the good news is that there are so many companies now in the last 3 years that have entered this space of menopause treatments over the counter or online. And so there are a lot of very affordable options. And Dr. Margaret, you even mentioned some like, coconut oil that you can just buy from the supermarket. I have a friend who swears by coconut oil. So, there are a lot of options. So always our point, always our message is nobody should ever have to suffer. Nobody. Too many options out there, both with your doctor or without your doctor.
And avenues to get help. Right.
Absolutely. Exactly right. So now we're going to a topic that has been really, really a hot topic for a number of weeks, actually really since November, I want to say, when we started to see articles about it in the general media, about how all these celebrities were losing weight by taking Ozempic, right, which is a medication for diabetes. And so everyone started to focus on weight, and specifically adipose, as you call it, weight or fat. I call for short belly fat. And it's that fat in the middle of your body, which is so incredibly common, but can be very, very unhealthy. It's also known as visceral fat. It can kind of weave itself around your internal organs. It's just not a good kind of fat to have. So you really want to try it. If you have it, try to get rid of it. If you don't yet have it, try not to get it. And so we're going to talk a little bit about that. And in fact, Dr. Margaret, you were on a great panel just a few days ago with another great medical expert talking specifically about this and talking about obesity in America and the different medications and really everything. It was a very in-depth conversation. And everyone, I just want you to know, if in case you didn't hear that, I am going to have the link to that event in the show notes. And I really encourage you to, after you listen to this, to go to the show notes, check out that link and listen to Dr. Margaret and the other medical expert. It was really incredible. But anyway, let's talk about weight, because this is a big issue. We saved it for last. It's number 5 on our list.
The session that I did was, and that's a great idea to link it here. Absolutely. It was organized through a group called Let's Talk Menopause, and it was done with one of my favorite experts, Dr. Fatima Cody Stanford, who is phenomenal. She's brilliant. She's amazing. And really an expert in
and the two
treatment.
Of you together were just really phenomenal.
Well, thank you. Thank you. So in terms of weight, I mentioned it before when we talked about heart disease. Change in estrogen, lack of estrogen, causes a cascade of events that occur in the body. And one of them is that the body becomes less sensitive to our own insulin. And this means that there's an increased propensity to putting on that visceral fat or adipose tissue. And this outweighs our ability to lay down new lean body mass and keep the muscle there. And so it's sort of a struggle in the menopausal years to be able to prevent that weight gain. And we know that as people age, there is a certain amount of age-related weight gain in everyone, in men, in women, in others, all whatever. There is an increase in weight, but there's also a specific weight that occurs with that without estrogen. And it's that weight that is one, troublesome. And as you said, it's an increased risk for heart disease, for brain disease, and for other. And so people do really want to do what they can to be able to prevent that. One is, as I mentioned, is decreasing the carbohydrate intake and trying to increase protein. And I'm saying very general things, but of course this doesn't apply to everyone. And we have to do the best way of eating healthily for each individual. Exercising, just as we, have promoted throughout, is super, super helpful for this as well. And there are some individuals that really need to be helped and go on actual either over the counter or prescription strength insulin sensitizers such as metformin, which is a prescription one, or even the newer, what you were talking about before, which is the GLP-1 receptor agonist, which
like
can...
Ozempic.
Ozempic is one of them.
Mm-hmm.
Wegovy is another one.
Mm-hmm.
Semaglutide is the ingredient that you're talking about. A newer one, Mounjaro, is another one that's come out. And there are even a couple of other ones that are going to be hitting the market, and they have become incredibly popular. They happen to be very effective, and they really, on average, they can reduce body fat by 20%, which is
That's incredible. That is like a magic pill. I mean, which we didn't think exists.
Yeah, well, and it's not even that magic, because it's working at many different centers. It's working at the brain. It's working at the appetite control center. It's also improving insulin sensitivity. So it's actually like an anti-diabetes way of working, and it delays the emptying of the stomach. And so you feel full longer. So you have less desire to eat. And you feel like you're full, so you don't feel like you need to eat. Got to remember to eat too, because you don't want to fast when you're on this. So it works at many different levels.
Incredible.
It's very well. Everyone a little bit differently, but it works very well. It does have some side effects. In some people, it can cause some nausea, even vomiting in some individuals. A trick is to not have as many bubbly foods and really keep the fats low. And that can be very beneficial. Eating very small meals can be helpful. And there is a risk of pancreatitis. It's a very small risk, about 1%, but it does exist. So they're not exactly risk-free. And so Ozempic, you mentioned, is FDA approved for diabetes.
Right.
For type 2 diabetes, whereas Wegovy, same ingredient, but different medication, different marketing, different manufacturers, what I was looking for. You see, that's that brain fog I was talking about in the beginning. Get the names, but that's indicated for the treatment of BMIs above 30.
Above
so they have
30.
Different indications. Exactly.
So some of the downside too, you mentioned there is a risk, small risk, but a risk nevertheless. But also my understanding is, as of today, most insurance companies will not cover it unless you fit that description of someone who has a certain BMI or has diabetes already.
Correct.
And also, tell me if I'm right or wrong about this. I believe that once you stop taking it, then the weight comes back. In other words, you have to stay on it. Is this true?
It likely is true, because the way that it's working is helping you moving forward. And yes, I do have some patients who have gone off successfully and have not regained the weight. But yes, this is something that once you begin, you have to keep taking, although you can reduce the dose tremendously.
Got it.
So even it comes in different divided doses, but even if you've worked your way up to a certain dose, you can then reduce down and be on a maintenance dose. So there are a lot of different ways of being able to use these medications, but an individual would really have to meet the criteria and have the benefits outweigh the risks for that individual. But for someone who does have a BMI above 30 and has used other products that hasn't been beneficial for them, or someone with type 2 diabetes, these are newer options that are very effective.
Right. And that's really good news, I think, for a lot of people. So even though I always go, as we all do, like, celebrities, they're doing something. Everybody has to go on Instagram and see what they're doing and follow. It's like, no. But, in a way, the silver lining of this has been that there's been more focus on it, and that people now know that there actually are options for them to discuss with their doctors. So, I guess that's the good news with the whole media thing with the celebrities and Ozempic. But so we have to look at it that way, right?
Sure. It's always a good positive. I've credited, people for being able to enlighten us.
Exactly. But, the theme, though, we're going to start to close out now. because we've covered all five, but the theme is that, yes, there are options out there for all of these things, but you really want to talk with your doctor for the most part, with almost all of them, to see what's best for you, because you're a big believer, and your overall message always has been, Dr. Margaret, that you're an individual, that this is personal. And so, what works for me may not work for you. And that's really, really critical. But the really big thing, as you said early on in this conversation, everything does kind of come together with exercise. Every single one of these things that we talked about will benefit, risks will be mitigated if you move your body more. But right, so it's always so much fun to have you on the show. And you'll be back in a couple of weeks because that's what we're doing. We meet up every couple of weeks and we talk about what's going on out there in the world of women's health. But before we go, we always love to ask you, what are your 3 biggest takeaways, or however many you want to give us, of today's conversation?
Good. I'm excited to give you my 3 takeaways.
Yay.
But before I give you my 3 takeaways, so when you suggested that this was going to be our topic, we said, okay, we're going to pick the 5 things in our bodies that change after menopause. And you're right. Everything gets better with exercise, except maybe vaginal dryness. That may not improve with exercise. But
excuse me, does sex count as an exercise? Because every study I've ever seen that if you use it, right, it's better.
You might be right, Barbara. I think you might be right. You're onto something. Definitely. One thing that I think, one message is just that there are so many different parts of our body that are affected as menopause occurs and continues. And, things that we didn't even mention, as skin, that's a big difference. Hair is a big area that we didn't mention.
Oh, yeah. Actually, hair loss.
The microbiome, the digestive tract, these are areas we didn't cover. We covered the 5 big areas, and particularly brain, which I break up into a lot of them because that really accounts for a lot of the symptoms. So my main takeaway is that estrogen receptors are just about everywhere in the body. And if you are someone who has had significant changes in menopause, of course, the answer is go see your doctor, but it might be a chance to think about, what can I do? The second, of course, is individualized, that no 2 people are exactly the same. We all metabolize medication differently, food differently. We have different likes. We have different dislikes. So I think find something that makes you happy. Try to get enough sleep. Try to reduce your stress in order for you to stay healthier, happier. Of course, if that incorporates a little exercise in there, that would be good. And so that's the third one, is find ways in your day that you can get those extra steps in. And I know that it's so difficult. And every day I'm trying to figure out, how can I make this happen? And how can I walk just a little bit? Because I do find that even a little bit makes that difference. So those are my 3 takeaways.
Yeah, and another thing that I've been seeing in the media a lot lately is something that they're calling exercise snacks, where studies are showing that even if you do something vigorously, like really get the heart rate going for 2 minutes to 10 minutes, you're really benefiting. And specifically, they're talking about benefiting the brain once again. It's amazing how much we can really do to help our brains to age better. It's amazing.
I think those are the key things. Individualized, go ahead and get a checkup, sleep, overall health and well-being, and really trying to find something that whatever that wellness is, whether it's breathing or whatever it is that is good for you, that keeps you happy. And because if you're happier, you'll be healthier overall. So
that's right.
Those are my
and all of this will help you to age better. All right, Dr. Margaret, thank you so much. See you in a couple of weeks. And don't forget, everyone, to listen to next week and learn about how breathing can really help you to age better. I'm a convert. I don't want to oversell it right now, but you'll hear my enthusiasm during the conversation next week.
Well, I can't wait to listen also.
Bye, everyone. Thanks for tuning in, everyone. If you enjoyed this episode of Gruff Talk, please do 2 things. First, share it with all your friends and family, and subscribe to Gruff Talk wherever you listen to podcasts, including YouTube, so you never miss a single episode. Until next time, remember this. We can't control getting older, but we can control how we do it. Talk to you soon. Age Better Podcast is a proud member of the Sound Advice Network. Sound Advice, women's voices amplified.